here for the appointment, right? Yeah, I remember you. So, as you know, we've seen each other last week because, well, you've had an injury at your head at cheerleading practice. You've hit your head pretty badly. And so this is when I arrived to check on your injury and see how bad it was. So it turns out you've had a concussion, and this is why we're seeing each other again today, to check up on you and to see basically how well you are recovering, okay? So today I'm gonna ask you first a couple of questions first, but basically we're gonna do a cranial nerves exam. Well, cranial nerves are the nerves taking care of your face and head and neck, and I just want to make sure that you're not having any injuries linked to the concussion or anything, okay? That you are recovering well. So yeah, I have a couple of questions to start off. So have you experienced any memory loss? Do you remember everything that happened? Everything I'm telling you is clear? Yeah? Okay. So you remember everything that happened, how it led to the incident? Yeah? And same during this week, do you remember everything that happened to you, or were there things that you forgot about your past, or anything really small or big? Mm-hmm. Okay. Alright, so you did take a break from practice, right? Like I told you to. Hmm? Okay. Have you hit your head this way before, or was it the first time you've had such a brain injury, well, this big, let's say? Was it the first time? Okay. Right, so are you still in any pain? Are there specific areas of your head still hurting, or do you have maybe headaches or migraines or anything? Okay, do you still feel nauseous? Because you did feel nauseous right after the incident. Okay. How did you feel the following days of the incident? Mm-hmm. Okay. Did you sleep well? Okay. How has been your vision? Have you experienced blurred vision, double vision maybe? Okay. Have you developed a sensitivity to light, bright lights maybe? Okay. Do some sounds appear louder than before? Some sounds you cannot stand at the moment? Okay. Any ear ringing maybe? Has it been hard to focus these days? Do you experience maybe some brain fog or such things? Okay. Have you been feeling especially clumsy? Okay. Right. What about your appetite? Have you been eating as much as before? Has your sense of taste or smell changed? Anything you cannot stand that you liked before, for example? Okay. Do you feel like you are reacting more slowly than the usual, or you may be speaking more slowly as well? Do you take more time to gather your thoughts? Okay. Alright, very last question. Are you allergic to essential oils? No? Good. because I'm gonna use some in the test. Okay. All right. Good. Now I have a couple of exercises to perform on you today, and I'm gonna start by touching your face and touching the area where you got hit. So please remind me where you got hit at the head, please. Okay, so around here. And is it still hurting you? A little bit when you touch it? Alright, okay. Okay, well, I'm gonna go very gently, like I said. Alright. Okay. Yeah, I don't see any abnormal growth or anything, and it's very much usual to still have a bit of pain even a week after such an incident. Okay, good. I'm gonna perform a couple of exercises on your face. I'm gonna ask you to clench your jaw, and I'm gonna touch your temples and your jaw as well. Okay, so clench your jaw and try not to move. Thank you. Okay. Right. All right. So I'm not seeing any abnormal growth or anything, which is a good thing, of course. And for the pain, I'm telling you, this is rather normal, I'd say. Alright, I'm gonna test out your vision now, okay? I'm gonna ask you, well, to cover one of your eyes. Okay, so let's start by covering the right eye. And I'm gonna ask you to tell me how many fingers I'm showing you, okay? So let's start. Good. Okay. Very good. Yeah. Okay. Yep. Alright, perfect. Now you close your left eye and we do the very same thing. So, yeah. Okay. Very good. Alright, perfect. Very good. Alright, now I'm gonna ask you to, focus on my nose. I'm gonna show you one finger and I'm gonna ask you to focus on either the finger or my nose, okay? And you're gonna do this quickly, right? So let's start. Can you focus on the finger, please? Focus on my nose, right? The finger, my nose. Focus on the finger, my nose again, the finger, and my nose. Okay, good. Perfect. I'm gonna see how your pupils now react to light. So, okay, they're looking good right now. I'm gonna perform a little test. With this light, okay? So, yeah, look at me. Very good. Okay. Perfect. Right. Okay. Very good. Are you feeling any discomfort with the light? That's okay. Good. Perfect. Very good. Yep. Okay. Alright, perfect. Alright, now I'm gonna go a bit further from you. I'm gonna show you 2 fingers and I'm gonna move one of them, alright? And as I do this, you're gonna focus on my nose only and use your peripheral vision to tell me which finger is moving, okay? So you can either point the finger or tell me your left finger, your right finger, okay? So focus on my nose again and let me know which finger is moving. Very good. Okay. Perfect. Okay. Let me know if I'm moving away from your peripheral vision and you cannot see the fingers anymore. Perfect. Okay. You let me know too if you're having any double vision or issues telling me which finger is moving. Okay. Okay. Okay, very good. Alright, we're gonna do close exercise to this one. I'm gonna show you one finger, move it around, and same, I'm gonna ask you to tell me when I'm going away from your peripheral vision and you cannot see the finger anymore. And I'm gonna ask you also to tell me if you're having any double vision at any point. Okay? So for this exercise, follow the finger, but do not move your head, okay? Okay. Do not move your head. Okay. Very good. Okay. Have you been going to the gym even though you're out of practice for cheerleading? Okay. Right. Okay, very good. Now we're going to do the very same exercise but with the light this time, okay? And same, you tell me if you have any double vision, any issues with seeing the light anymore, or if the light is too bright for you as well, okay? Alright, so follow the light and do not move your head. Perfect. Very good. Okay. You're doing great. How are you feeling so far? Do you have any discomfort in your eyes, in your head, any headaches or anything? Okay. Very good. All right, perfect. Alright, I'm gonna ask you to perform an exercise for me. So I'm gonna show you which exercise it is, and then I'm gonna ask you to do the very same thing. Alright? So you put your arms like this, and I'm gonna ask you to touch your nose, okay? With each arm, with each fingers, okay? This way, right? So you look at me and you do this exercise, okay? Now it's your turn. Go on. Okay, keep going a little bit longer. Keep on going. Okay, that's it. Very good. Thank you. That's perfect. Alright, I'm gonna do a test now with your face. So I'm gonna use this tool and I'm gonna touch several points on your face, and I'm gonna ask you, well, to let me know if you do feel anything, and yeah, if you feel the same thing on both sides or not. So I'm gonna start now. Do you feel anything? Mm-hmm. Okay. What about now? Mm-hmm. Now do you feel... Yeah? Okay. What about now? Okay, good. Okay. Do you feel it? And now? Yeah. Okay, perfect. And would you say that you felt the same thing on your left and your right side? Okay. Very good. Okay, well, now I have a couple of tests for your other senses. So I'm gonna use this bottle, this component. I'm gonna ask you to smell it and to let me know what smell you are smelling, okay? If you recognize the smell. So okay, can you smell this, please? Yeah. And what is it? Orange. Very good. So that's good for the smelling test. I'm gonna write that down. Perfect. Now I'm gonna test your taste, okay? So I'm gonna use another Q-tip and I'm going to use this thing here. So you let me know what you taste. So open your mouth and show me your tongue. Good. Okay. Very good. So, what do you taste? Vanilla. Very good. It smells like vanilla as well. Perfect. Very good. That's it for the tasting test. The very last test I have for you is about your hearing. So I'm gonna basically make noise at your left side and right side, and I'm gonna ask you to close your eyes and tell me which ear you're hearing the sound, okay? Either left or right. And later on I'm gonna, as you still have your eyes closed, I'm gonna whisper numbers in your ears, and you're gonna tell me which number you are hearing, okay? So, close your eyes now. Yep. And I'm gonna start by the sounds, and you let me know if it's either left or right. Uh-huh. Okay. Very good. Mm-hmm. Right. Very good. Okay. Okay. Mm-hmm. Perfect. Yep. Very good. All right. Perfect for this one. Okay, so very last test. I'm gonna say numbers in your ears as you have your eyes closed again, and you let me know which number I said. Okay, let's start. 22. Mm-hmm. 41. Okay. 2. 99. Very good. 56. Mm-hmm. 9. Okay. 7. 11. 40. 86. 100. Okay, very good. Okay, so that's it with the test. From what I can say, you are recovering well, and that's very good. So take care of you. Do not hesitate to come back if you feel like you're having any more issues regarding all of your senses. Like I said, with the brain, you can never know how it's going to be visible that you are still having issues and an injury. So whenever you feel that something's not right, you come back immediately and I'm gonna be taking care of you. Okay? So thank you again for coming. See you very soon. See you next week, and take care. Okay?